1 in 3 women in the U.S. each year have babies via C-section. 750,000 women each year have hysterectomies. 600,000 gallbladder removals are performed annually. This doesn't include appendectomies and elective type surgeries, emergency surgeries. Why is this important to you as a health and fitness professional? Because you can become an integral part of your client's recovery from surgery. And I'm not just talking about 6 weeks after surgery when they return to their normal activities. I'm talking about those clients who had had no one help them after surgery, even if it was decades post-surgery. My name is Janice Maddock. I'm the director for the Institute of Integrative Health and Fitness Education, as well as the co-author of What Lies Beneath: The Under-Realized Effects of Breast, Abdominal, and Pelvic Surgery. And today I'd like to share with you what we've termed in the book the post-surgery cycle and why it's important for you as a fitness professional to understand the cycle when you're working with your clients post-surgery. When you think of surgery, there's many steps that happen during the surgery that the surgeon takes care of. Oftentimes, after a follow-up or two, that's where the surgeon leaves the picture. Maybe there's a follow-up a few months down the road, depending on the seriousness of the surgery. But oftentimes, a patient may not see their surgeon much after the surgery is completed. However, when it comes to thinking of a woman who's had a baby via C-section or a woman who's had a hysterectomy, why is this any different than a person who's had a hip replacement, who has follow-up physical therapy? It really isn't. However, for some reason, it is. We speak all over the world, and we always ask the question, how many of you had physical therapy after your C-section? If we're lucky, one person raises their hand. It's just not normal protocol in the US. But this makes then a very important role for you as a fitness professional. So let's talk about that post-surgery cycle. Pain, scar tissue, muscle inhibition, and compensation. Your client has had major surgery. They're likely going to have pain, and more pain after the painkillers wear off. They're going to have scar tissue. It's part of the natural healing process. Something's been opened up, possibly taken out, and put back together. Layer after layer after layer has been put back together. As the body heals, it lays down new tissue. This new tissue, however, is not as flexible as the previous tissue, and it's sticky. Sticky means oftentimes it can intertwine with or wrap around or attach to other muscles, organs, blood vessels, nerves, other just tissue in the body. Muscle inhibition. This is when the body or those muscles in the body don't work like they're supposed to, meaning they may not turn on when we need them to turn on, they may fatigue quickly, and they may atrophy. This is more of our deeper myofascial system. So when we think about the core and the pelvis, think about transverse abdominis, diaphragm, pelvic floor, psoas, multifidi, those muscles whose primary role is to stabilize joints. They're smaller and their job is to stabilize. And then we have compensation. We think of this most often, I think, when we have a client who sprained an ankle, because they're gonna walk differently. They compensate around the injury. Well, the same thing is gonna happen when we have surgery in the abdomen. We might not breathe the same. We might start to hold things in, tighten things up because we don't feel like we can do that anymore. We start to compensate. We don't move as fluidly as we did before the surgery. So we start to compensate. And something that's important about the post-surgery cycle is it's not a cyclical cycle. You don't have one, then the other, then the other. You can have pain that causes muscle inhibition. You can have muscle inhibition that causes compensation. Pain can cause compensation. Scar tissue can cause compensation. Scar tissue can cause pain. And that's why your role as a fitness professional when working with these clients is so important, because one, they likely didn't have any follow-up therapy post-surgery. And two, they might be coming to you long after they've had surgery and they've built up maybe a world of pain, maybe a world of tightness, maybe a world of compensations. So your role becomes so important because you can help break the cycle that they're having. So that's the post-surgery cycle. Start to ask your clients, if you don't already, very specifically, have you had surgery? If you've had surgery, what type of surgery did you have? Don't let them get away with, that surgery was 20 years ago. We all know if we have a compensation, it doesn't go away oftentimes on its own. If they had surgery, did they have any kind of infection with the surgery? Did they have any follow-up surgeries? How did they heal? Did they heal well? Ask them those questions. And don't let them get away with minimally invasive. I just had a minimally invasive surgery. At the course that we teach, I'll share with you the information and research on minimally invasive surgeries in the area of the pelvis and abdomen. So think about the post-surgery cycle: pain, muscle inhibition, scar tissue, and compensation, and start to assess your clients for their compensations. It will tell you a lot. That's the post-surgery cycle. This is part of our half-day course that we talk about when we talk about what lies beneath the under-realized effects of postural and movement effects of abdominal and pelvic surgeries, and how the fitness professional can address them. So how do you as a fitness professional address these issues? This is what we're going to discuss. We laid this course out in the same manner as our book. So we're going to create awareness. We're going to talk about the common symptoms that your clients may have. And they may not be in the area of their pelvis and their abdomen. It can be neck tightness. It can be digestive issues. It can be respiratory issues. It can be foot pain. Just because the surgery was here doesn't mean that's the only place they're going to have symptoms. Then we're going to just talk about the staggering statistics. So you get a scope of how many people have had surgery and the questions you can start to ask your clients. Then we're going to go into the address phase. This is where we're going to start to assess our clients. We're going to give you super quick, easy assessments that you can use with your clients so that they can start to feel the difference of what you're doing in your session. Also in our address phase, we're going to look at those muscles that have become very tight in response to surgery and compensation. We're going to show you what key muscles you want to help your clients release. Then we need to start to activate those muscles that have become inhibited. And we're going to do this through becoming very mindful and using breathing. Let's think about that. Deep muscles that have become inhibited. If I can use breathing, because this is so important. This was such a beautiful thing when we got to see this in the anatomy lab. Your diaphragm fascially blends with your psoas and your transverse abdominis. And your psoas blends with your pelvic floor. So breathing becomes so important when we start to work with our clients post-surgery. We're able to access these muscles that have become inhibited through breathing, but we have to be very specific on how we're teaching it to help our clients do that. So we're going to create mindfulness with our clients and help them understand why breathing is so important. And I can tell you, with all of our clients, they'll come back and be like, I always do my breathing. So just a little note, they always do their breathing, but I will tell you why. And then we're going to take you through this quick integration that you can start to use with your clients. You can take them through stages as they progress, and it's a safe progression so that you can help them assess, yes, this worked for me, no, this didn't work for me, yes, I'm ready for this, no, I'm not ready for this. And then we're going to empower your clients. Empower them to take control over the situation that they're in. Empower them that if they're not with you, they have strategies to get back to where they need to be. So I'll finish with this brief email that we received from somebody just today. In the email, she said, I wish I would have had your information 30 years ago, after my first C-section. Everything you describe as compensations I've had in the last 30 years. I had a world of tightness and pain. And using your information over the last 3 years, really incorporating the breathing into my life, has changed how I feel today. I feel the best I've felt in 30 years. And then she went on to say, I hope you share this information with so many people. So our response to her was, our goal and our message and our mission is to share this with as many people in our practice as well as with health and fitness professionals who are working with women post-surgery. With that, we hope that you join us at this short 4-hour course so that you can start to have a big impact on your clients who've had surgery. We hope you can join us. We're going to be in Kansas City on April 5th doing this half-day course, and then following it up the next day with a full-day course on the female core.